Are you planning to relocate to Ottawa? If so, you might be wondering, how does the healthcare system actually work here? I get this question all the time from clients who are moving either from another province or even another country right here to Ottawa. And I totally get it. When you're uprooting your life, knowing how to take care of your health and your family's health is paramount. If we haven't met, my name is Liam Swords, a local real estate agent right here in Ottawa since 2002. I've helped hundreds of families make a smart move right here to Ottawa. And a big part of helping them is understanding what life looks like beyond just buying a home. In today's video, I'll walk you through everything you need to know about the healthcare system in Ottawa. So how does the public healthcare system in Ottawa work? Well, in Ontario, it's called OHIP. This is short for the Ontario Health Insurance Plan. If you're eligible, OHIP covers most medically necessary services at no cost to you. That means doctor's appointments, hospital visits, surgeries, and emergency care are all covered under this program and free essentially for you. You do not pay at the time of service. It's all funded through taxes. Oh, and quickly, if you're thinking about buying a property in Ottawa and are serious about this and you want to get the absolute best price, then please check out my home buying secrets. These are buying tactics I've used over the past 20 years to save my clients on average $21,000 on their home purchase. If you want access, just click the link in the description. Now, back to the healthcare system right here in Ottawa. How to apply for OHIP? When you move to Ottawa, your first step is to apply for a health card at Service Ontario Centre. That's your ticket to public healthcare. You'll need proof of identity, proof that you live in Ontario, like a lease bill or utility bill, and proof of immigration or residency status. Here's the catch. There's usually a 3-month waiting period for new residents. So if you're coming from another province or from abroad, make sure to get a private healthcare insurance coverage during that lag time. Finding a family doctor in Ottawa. This part can take some time, especially depending on which neighborhood you move to. Find a doctor. You register with Healthcare Connect, Ontario's matching service. You can check with local clinics and simply ask around to neighbors, coworkers, even your fellow realtor might have a recommendation. If you don't have a family doctor yet, don't worry. Walk-in clinics are widely available and most of them are covered by OHIP. So what's covered and what's not covered with the Ontario Healthcare Program? Let's break this down for you. So covered by OHIP would be family doctor visits, emergency room services, hospital stays and surgeries, maternity and prenatal care, medical tests like blood work or x-rays. Now let's take a look at what's not covered by OHIP. Dental care for most adults, prescription drugs, unless you're a child, senior, or special plan, eye exam for adults between the ages of 20 and 64, ambulance, transit, partially covered, but there's usually a fee on top of it, mental health therapy outside of the hospital. That's where private health insurance or employer benefits can make a big difference and look after those ones that are not covered by OHIP. Emergency services and after hours care. Ottawa is home to several top tier hospitals like the General Hospital, the Civic Hospital, CHEO for children, the Queensway Carleton Hospital, and the Mulford Hospital. If you need urgent care, but it's not life-threatening, walk-in clinics and urgent care centers are great options outside of the emergency department at the local hospitals. Plus, Ontario offers Health Connect Ontario services, where you can speak to a nurse 24/7 over the phone. And in recent years, virtual care has become huge. Many doctors now do online appointments, which are also covered by OHIP. Healthcare for kids and families, a big one. If you're moving to the area and you have a family, this would be a major concern or thought process. So for families with children, Ottawa's healthcare system is really supportive. Kids are covered for most prescriptions and medications under OHIP, dental exams until age 17, pediatric care at CHEO, one of Canada's top children's hospitals. There's also great public health programs for newborns, vaccinations, and parenting support. Bonus tip, if you're moving here to start a business or work for yourself, you don't have employer-provided benefits. So it's smart to look into private insurance for extras like dental, medication, physiotherapy, massage therapy, mental health support. Plans can be really flexible and affordable, and they'll give you the peace of mind, especially if you have kids or dependents. Well, folks, that wraps up a full full breakdown of how healthcare works right here in Ottawa. From getting your health card to finding a doctor to understanding what is covered. You're now one step closer to feeling more confident about your move. If you have more questions about moving to Ottawa, whether it's neighborhoods, schools, or day-to-day life, I'd love to help. All of my information is below in the description. Please send me an email and we can connect for a call. We also have a risk-free guarantee called Love It or Leave It, which means if I help you buy a home and you're not completely satisfied, we'll sell it for free in the first year of living there. I want to thank you for watching and we'll catch you on the next video.